Uh, all right, awesome, great. Karibuni sana. I'll also fire up the AI summary, so you can kind of keep the notes, which basically means then we have to speak in English at least for the first hour. When you, unfortunately, Zoom AI doesn't speak Swahili, so it kind of gets really confused when people kind of switch and start speaking Swahili. It's kind of like, well, are you still speaking English? What's going on here? But the reason I'm firing up the Zoom AI, it's a really great summary tool. So you can really capture many of the highlights, many of the takeaway points and whatnot. So without further ado, my name is Dr. Frank Minja. I'm based here at Emory in Atlanta, Georgia. And I'm a neuroradiologist. So we read images of the brain, head and spine. And that's what I've been doing for a couple of years now. And also one of my other interests is basically training programs in East Africa. We are based both at Muhimbili in Tanzania and Makerere in Uganda, where we're doing intervention radiology, neuroradiology, and also women's imaging as subspecialties in radiology. So we can talk about that. And then, why are we doing this, contributing to the brain drain, I guess. But this is the issue here, is to make sure that you guys are getting the best education possible. And I think, having the US experience really offers that opportunity for you to really hone your skills. And then once you're really skilled, we can then tap into maybe 10, 15 years from now to kind of help us in some of the efforts that we're doing out in East Africa. So without further ado, I welcome my colleague, Dr. James Ignas, who's based in Connecticut, and he's gonna take us through the actual application process. And just by way of record, usually we record these talks and post them on YouTube, so that way we can share this information widely. Karibu sana, Dr. Ignas.
Thank you very much. Good afternoon, everybody in East Africa. Good morning for the people from the US. My name is James Ignas Kula. I'm an internal medicine, preventive medicine certified physician, and I work as Associate Program Director for the Internal Medicine, Preventive Medicine Residence Program at Griffin Hospital, Derby, Connecticut. It's my distinct pleasure to be here with you. This is the third and last session of the USMLE series for the academic year 2024-2025. So we usually, our mission is really to support you, and that's the essence of starting this USMLE series through our USMLE Pursuit. And we try to support people from East and Central Africa to kind of secure graduate medical education training spots in the US. And we did one-on-one, I think, in November. So we tried to do it when the new academic year starts for university there in East Africa. And that's an open forum. Everybody can come in. You even you are driving a border, you can come in and attend a one-on-one. And then I think around February, we did 201. And this is for people now to tell you how to prepare for the exam. One-on-one is basic. You don't know USMLE at all. What is USMLE and what is all about? And then 201, now the people who have got USMLE numbers, we talk to them on 201 and tell them how to prepare for the exam. And it's real sad. I've had a significant number of people who have failed the exam. But most of them, when I talked to, they didn't follow the simple direction of the things we told them to do. So it's really important as you are mentoring people to kind of check in and kind of go into the details, because somebody think, can just do offline modules and go and take the exam. It's not that way. So whoever is listening, if you have not started USMLE, make sure, you use the recommended materials, and you really, grind through and follow the process. You follow the process 100%, you're gonna pass. But that's not a problem for you. You are here on this 301 because you are either ECFMG certified, or you're gonna do step 2 CK very soon, according to the information you gave me, and that's why I invited you. So these are all the people who have a skin in the game, and we are really excited to help you and kind of guide you, and make sure that come September, you can put the strongest application possible, secure a graduate training slot, and move on to train. So I would like to share my slides so that I can be more descriptive and systematic as I explain my quest. And just a moment, I want to make sure I can pin myself and then I can see myself a little bit. Excellent, excellent. So welcome to USMLE 301. And of course, as I said, I'm the Associate Program Director for the Internal Medicine Preventive Medicine Residence Program in Griffin Hospital. And one of my core functions is to review applications, interview applicants. So this is something that I do on a daily basis. And I'll try to digest key points of the things you need from preparation, submission in such a way that you have a very strong application, because I can give you a scope from a program perspective, what we are looking at, so that you take that into consideration and, put your strongest application possible. As I said, you do a mistake, it costs you a year of your life. So it's very important. And just to give you a warning, there's a lot of psychological warfare going on. There's a lot of information online. People are putting there to play with your mind. Just stick to the point. Do what you're supposed to do. You will be fine. It's not the end of the world. So I've brought in a couple of panelists to help me with filling in the blanks. And mostly, as I said before, they recently matched the applicants who are really coming through, and they can share with us what is going on. I was expecting to have Dr. Roland Semakula. He's from Uganda. He's doing pediatrics in Texas, representing the Peel of Africa. I've not seen him. I hope he'll be coming in and, continue giving us insight. He's now PGY1 and in July is going to be PGY2. And then I have with me among the current residents, Hezbon Magacha, born and raised in Tanzania, went to medical school in Cuba. He's doing internal medicine at East Tennessee University. He's PGY2. Actually, I started with him from the initial USMLE session. He has been an avid participant and, participating in mentoring other people. And I have Barbara Odak. Barbara is from Kenya. Went to Kenyatta University, is currently PGY3 in my program, Internal Medicine, Preventive Medicine. She's aspiring to do cardiology. Magacha is aspiring to do gastroenterologist. So this is the other thing, in the US, when you train, you have access to highly specialized training, and we will really encourage you to do that so that you can transfer like the real needed skills, back home. So we 7 people who went through the USMLE group discussions matched this year. So we have 3 Tanzanians and 4 Kenyans. And I'm lucky to have the 3 of the matched applicants here with us to kind of participate and share with you. This is really exciting time, It's when you match, it's really the pinnacle of the process. You have really accomplished. And so we kind of, look forward to support all of you to realize that. And I will insist for you guys who are applying this year, please update us about your March results. We really look forward. We are as anxious as you are, looking forward to hear like what is going on. So it's really important that you update us. And this is what I want to do going forward. So I made this decision like from yesterday, that once you have your ECFMG certification, email us to the USMLE pursuit that you have your ECFMG certification. I'll give you my personal cell phone number. From there, it starts being personal. That, you're a colleague, you are ECFMG certified. And I look forward, and what I expect is, as much as we are trying to help you and do this, it's not that we have a lot of time. We are squeezing time to help you. You will help others. You'll stop in and kind of help others and open the door for others. That's what we'll be doing. And I'll talk more about it. But I really want to get the information as the March results come in, as I'm as anxious as you are. So one of the March applicants who is here with us is Elgape Urasa. He studied at KSMC, is from Arusha. Arusha nickname is Chuga, so he's a Chuga boy. He's coming to do pediatrics at St. Bernard's Hospital in New Jersey. Welcome, Elgape, and thank you for being here with us, and congratulations for the match. We have Dr. Nunex Mongare. Is from Kenya. I went to University of Nairobi. Nunex is coming to do neurology at Duke University, is interested in endovascular interventional neurology. Nunex, of course, after he matched, we started chatting and he told me he's interested in endovascular, and I'm already thinking like, Nunex, I need to connect you with this endovascular consultant, because it's a competitive field. You need to kind of, start building your story. So this does not end when you match. People think when they match, then they have arrived, that's the end of the road. It's not that case. You will continue to, even when you move from attending, from resident to attending, you get a contract to sign. You can look at that contract, is 30 pages, don't know nothing. I can tell you quickly, look at this and this and this. These are the bombs you should avoid. You should tell them do this, and that can change your life, So it's very important. We keep the brotherhood, the sisterhood. We help each other. We step in, and we are eager, to continue to support you. So we have with us also, God bless Filippo, is from Tanzania, graduated from MUHAS. Is going to do pediatrics at the University of Minnesota. I think he's now at Lutheran Medical Center in Arusha. That's where he has been working. So he'll be moving from Arusha to Minnesota. Welcome, Filippo, and thank you very much for being here. And these are the people you should take advantage of, and kind of, as you're going through the process, get inside information. So this is another match, the applicants who I managed to get a picture of. She's not here in the panel. Her name is Irene Gatena. She's from Tanzania. She did her training in the Caribbean islands. Some people from the US will train in the Caribbean islands. So she's going to George Washington to do internal medicine. So we have 3 other matched candidates who I don't have pictures for. We have Dr. Jemutai from Kenya, who is going to Morehouse School of Medicine to do internal medicine residence. We have Dr. Atieno Pesa, is going to do PIDS in Indiana. She's also from Kenya. And Dr. Mutinda. Dr. Mutinda is from Kenyatta University, Barbara. She's going to do internal medicine at Mason City in Iowa. So these are the 7 people who matched, through the process. So I thought it would be good to highlight and show, like, they did. They are among thousands who matched, and we are rooting for you, and hopefully we can have you guys who are applying this year on our slides next year. So don't deprive me those pictures. So in the way I've structured the talk, I will talk about the ERA system and then explain about the importance and kind of narrate about clinical experience, and then take you through what you need for personal statement and reference letters, program choices, how do you do, and of course the interview itself and post-interview. So you, as for the 7 matched candidates, you are our ambassadors to the program where we are going to. You are going to open door for others. There is nothing we in medical education we love more than a recommendation from a good resident, because we assume if you're good, your friend is also good. What does it mean? If you're mediocre, you're not going to open a door for anybody. So it's really important that you hit with your strong foot forward. We'll continue to mentor you aggressively and give you the cheat sheet of everything you need, because we want you to be good and to open doors in all those programs. People are going to 7 different programs. So these are 7 different programs we are adding to our portfolio for this year and the coming years. So represent us well. do well, succeed, and we are here to support you. And please, continue to do the right thing. So, yeah, I was not sure if I changed. So you are now done with exams. Of course, the application is in September, but it's May. But guess what? We are starting to talk about it because it needs preparation. So you need to prepare well before the system opens up. As I said again, for the applicants, congratulations for tackling your exams. You are among the few who really walked the talk. The attrition rate is massive. When I do one-on-one, which is open to everybody, by the time I come to 201, only 7% of the people who hears from me applies for USMLE number. So you are the top 0.1% who is coming through. And that's why as I was thinking yesterday, and I'm just digesting and thinking about this talk, I say, you know what? They have earned it. These are the people who, as soon as you get this FMG certification, let's go to one-on-one. And I think I'll look again on the list. I think most of you, I'm communicating with you already one-on-one, and except 1 or 2 or 3 people, I think. But it's as you get ECFMG certified, I'm real keen to step in and kind of, help out. And I cannot overemphasize that you make a mistake in your application process, you waste a year. So assume you waste a year earning at the maximum potential you can earn, so you can know how much damage that is. So it's painful. So try to be very cognizant and kind of put a strong application forward. So you need to put a strong application forward to maximize your chances of match and making the best of the work you have done. I mean, there's so much work that I've gone through. All of us, I mean, in the panelists, we have gone through what you have gone through. We know what it is. You sacrificed a lot in terms of, your time, your loved ones suffered through. And so you really want to reap the benefit. It's not only you, it's a system issue. So don't think that now you are done with your exams, it's time to relax. No, don't be cavalier into this. You have to give it your all and wait till when you get the word that you have matched. That's when you can take the foot off the gas pedal. So this is not the time to relax. It's real time to go all in to make sure that you have a very strong application for it. So ERAS, Electronic Residence Application System. I'm sure you have heard about this. You have to familiarize yourself with ERAS. You need to review, kind of know, understand, and ERAS will open and give a token. I'm not sure, around June probably. That's when you token is when you say like I'm applying. And so you take in to apply. So as soon as it come out, take your token. Even if you're not ECFMG certified, but you have your exam scheduled in July, and you think you're going to apply in September, take your token and start your application. Because as in between, as you are fighting between UWorld and whatever you are doing, you keep updating your application. And this also will kind of maximize your pursuit to take the exam, because you have your stake in the game. You have already, you don't want to waste your scarce resources. So be very cognizant when you narrow down the program you're applying to. If a program is saying they don't take more than 3 years after graduation and you are 7-year post-graduation, don't waste your money. Don't apply there. ERAS system has filters for us from the program perspective. I can say, I want people who have graduated not less than 5 years, who have scored, let's say in CK, not less than 230 and above. And those are the only people I'll get. So you have 220, you look at the program information, you see they want 230 and above, you have 228 and you think like, oh, I'm close, probably they'll look at me. They won't. They will filter it and they won't even look at your application. So you have to take time to pick the programs, research to. The people who have matched are really your role models. Ask them, where did they interview? Where did they apply? So if they interviewed them, they are more likely to interview somebody like you. So you have to kind of double down on those information and use it, to make your list and along those things. Presentation is everything. Take a nice professional headshot to use it for your application. It's high stake and approach it that way. Don't take a shabby picture, from your old techno phone and use it for your application. You know, we look, it's a Zoom era. We don't see you. What you present to us is what represents you. So it's very important that you don't kind of go cavalier about it. Why clinical experience? We as programs, we want to be sure that you are positioned to succeed. You know what you are applying for. You know, you will not be like a deer on the headlight when it comes July 1st. You know, so somebody will say, will apply to radiology. Like, you know, you have been in medical school, you know, I want to do radiology. You know, radiology is not even a rotation in medical school. Like you go there, you observe a little bit, you go, and then they come on day one, they have to read 20 images within a short term span, and he's like, what is this? Like, I can't stay here and just look at the screen all day long. That is not something I like. So they want you to find out what the program is all about through the observerships, the things that you do. So which means you know what you're coming to. Because the worst nightmare for programmer leadership is somebody 1 or 2 months down, they say like, you know what, I don't want this anymore. I don't think I can do this. I don't think I can do. I don't think I can look at this much EEG. When I look at an EEG and I see a chicken walking on the mud, they look the same. There's nothing different. So I cannot make my mind on this. So they want to make sure. So when you quit, when somebody leaves the program, then it creates a lot of problem, because if your calls were every 4 days, the calls becomes every 3 days. That's a completely different animal. Somebody who signed and he knew that is gonna do a call every 4 days. Now you let them know they're gonna do every 3 days. It's gonna make or break the program. Everybody will be grumpy, everybody will be mad. It will be such a big challenge for everybody. And so we don't want that. So when you have gone through the clinical experience, you have been exposed to the specialty you're applying to, it tells us that you know what you're coming to and you will not quit. And also, so it helps you sell your commitment to the specialty, whereby it shows, I mean, like you're applying to neurology, but you have never done any neurology stuff. How do I know that you like neurology, or you're gonna, you know, you're gonna have a thing? So when you do these clinical experiences, you rotate with people. They can vouch for your interest, your attitude, your work ethics, your potential to succeed. Those are the things we look at when we look at those reference letters, you know? So it's really important you do that, because then you can get a strong reference letter. Because if you ask a letter from somebody who you have not worked with, cannot really write a detailed, you know, reference letter to kind of convince us why we should take you and not take someone else. So observership is really a time to sell yourself. When you are there doing observership, you're like under microscope. Everybody is looking, are you going to be a good match for us? I mean, how are you as a person? Are you relatable? Are you personable? Or, you know, so people will do observership. And what they do is anytime they sit in a corner and they're studying for their steps. That's a waste of your time. When you go into observership, give it 100%. You know, you are, as I said, you're under microscope. People are looking, trying to gauge, is this a person who is gonna match well with us? Soren Unex, I Googled you. And I was trying to see, I mean, when I heard you match, like, what did he do? So you can see he's doing neurocritical care publications. He's doing prediction of stroke, you know, recurrence after initial diagnosis. I mean, so he's doing research related to stroke. And so when you're applying for neurology, you are selling your case and they see you know what you're talking about. You know, so your research, what does research show? It shows that you're academically strong, because when you train, they think most likely you can be a faculty member, so which is you can join the academic and teach, apart from treating patient. But also, what it tells is you can do something from point A to point Z and finish it. You know, writing a paper is not about writing about a groundbreaking issue. It's the logistics of you putting in, reading the editor's instruction, following them, kind of responding to the editors and everybody else, and having your paper published. So there's a process with it. So if you can do that, you can do any process. Those skills are transferable. So that's what it talks about. So we don't care that you publish, I mean, you are discovering something, you don't have to, you're gonna come to training. So as you enter your activities and experiences in the eras, now they become your CV. So be very cognizant as you enter those. And then you write your personal statement. And for you to write a good personal statement, you have to take time. You have to have multiple versions. You have to think through. Think early of how you want to present yourself. We read every word in those personal statements. You know, most of us here, English is not our first language, you know, so get someone to read through and see, make sure that what you wrote is making sense. You are writing what you mean. You know, in your personal statement, it's not time to explain to us how you suffered. Like I used to walk 10 kilometers to go to my elementary school when I was 6 years old. Nobody cares how you suffered. You want us to show, to demonstrate your love for medicine. You know, why does it, you know, why is it important to you? Try to use it to write something that is not in your CV, something catchy, something rememberable. I can't tell you the number of books I have read after reading people's personal statement and the quotes that they put in there. I mean, you read somebody and you enjoy. I enjoy the process, frankly speaking. And those people, you know, and there are people who I know for, you know, people will remember you and then they can rank you. So it's very important. And you will do this. You'll do this if you take your time. You take your time and invest in it. If you go and rush and write it like, you know, you are writing an email, it will just read like that and it has nothing personable and nobody, you'll just be another statistics. You know, so ERAS allows you to personalize your personal statement for all programs you apply. You can have literally a personal statement for all programs you apply. Let's say if you're applying 100 programs. It might be a lot for all 100 if you are doing other things, but for the key programs, make sure you know you mention the program there, which means the personal statement is specific for that program. So you label them, you create them, and then you label them as you change to personalize them. This is for SUNY Downstate, this is for Griffin Hospital, this is for Harvard, this is for Brown, and this is for whatever program. So you kind of, it shows like you invested your time in it. You know, for me, because I do IMPM, I recruit IMPM residents. If I read your personal statement, you are not talking about preventive medicine, I'm not going to invite you. So I don't use signals. I'll talk about signals later, but my signal is seeing that you have done, you know, preventive medicine, public health stuff as you're coming in and you're passionate about it because that's part of your training that you're going to do. So, so they appear to know what they are looking for. So when you personalize it, you know what you're looking for, and people can see and really appreciate and acknowledge like this is the person I want to see this person, you know, how is this person going to interview and how we gonna be relatable. In terms of reference letters, having a minimum of 3 letters is mandatory. Do not submit an application without 3 letters. If you do not have American letters, you can even use local letters to make sure you have 3. But anything less than 3, people will filter like at least 3 letters. If more than 3 letters, nobody is even going to look at your application. So I put American, you know, in bold and underlined it because any American licensed physician you encounter in the world, whether in the US or outside the US, and you work with them, they give a letter, it's as good as if you got that letter from the institution where they work with here in the US. So it's just we value what we know and it has more weight and that's what it is. You know, do not approach people for reference that you have no strong working relationship with. Because what they'll do is they write to you a simple general letter, which is weak, and a weak letter will count against you. You are better off to have a strong letter from somebody who knows you, who has not a lot of accolades, rather than having a mediocre letter from somebody who is big, but you know, because you have not worked with, and they just ended up giving you, you know, just a letter because you asked for it. They cannot say no. Make sure to tell your letter writer the specialties you're applying to. if they include. And if, for example, you are thinking to apply across to use the letter for different specialties, let's say like primary care specialty, you are using a letter for pediatrics, internal medicine, and family medicine. Then you tell them, please don't mention a specialty because I'm applying to peds and internal medicine. And so I want to be able to use it for both. And then they'll talk about your clinical strength, which applies across the board. But all this case, don't use a surgeon letter to apply for medicine programs. It will be kind of like an odd thing out, you know. So if you're applying for multiple specialties, then you should have, and you are having specialty specific letters, then you should have letters for all those specialties that you're applying to avoid, you know, kind of mixing up and seem like somebody, the way it appears is like you are not, you're not sure what you want. You know, you're not certain, and so you are indecisive. But it's not the case. I mean, for IMG, we know the challenge what is there, so people might apply to 2 specialties just because of the odds and everything else. But for them, people who have not gone through this process, the way they look at it is like, oh, you are not so sure what you want, and so penalize you for that. With virtual applications, people applying to more programs than usual. We'll get a scoop from the people who applied last year, who are going to start in July, like how they went about. That will be, they'll give us the most recent details as we go into Q&A and all those. And so getting first-hand information from recent applicant is really important. Where did they match? FREIDA is a website, is a free service offered by American Medical Association. And you, as a physician, you can apply for membership for free for AMA and have access to FREIDA. So FREIDA lists all the residence programs. They give like percentage of IMGs, description of the faculty, who they take. And so you can see and kind of narrow down. Like if a program has not taken IMG for the last 15 years, you're not going to be the first. You know, so you wanna kind of, and also AMA, the American Medical Association, have kind of mock interview program. If you register early, they can give you a mock interview where, you know, you can kind of have a simulated interview to kind of get hold of what it is and kind of get feedback before you go to the live thing. So this is a slide which I shared, I think, when I was talking about exam preparation, showing the median score for American medical graduates for different specialties. So you can see the highly coveted specialties, you know, like dermatology, neurosurgery, plastic surgery. People, even the American medical graduates, are going with median of like 255. And people with 245, for example, they didn't even match into plastic surgery. So these are US seniors, fresh graduates. Now, when you are coming in as IMG, 4-5 years post-graduation, you know, you have not even beat that number. You should not even think of that specialty, you know, because of the odds and everything. So it's looking, and this is the information which I give very early as people are preparing, because depending on how you score, you might have to shift your expectation. You know, and that's a realistic thing to do. You know, you judge, and we do it every day. You see, this is not my league. You and you know, you just move on and do things that work. So this was 2024. I didn't get 2025 update, but the numbers are not any different. These are surgical specialties. They are highly coveted. It doesn't mean that you need 255 to be a plastic surgeon. Even a 200 person can be a plastic surgeon. But what happens is more people once. The same way, when I was going to medical school and Muhimbili was the only medical school in Tanzania, they used to take just Division 1 PCB people, and they will end up like with 8-7 points, and then Muhimbili is filled, and you cannot. It doesn't mean somebody with Division 2 cannot go to medical school. They can, but there are other qualifying candidates who make it competitive, and that's the essence. So kind of, you know, be realistic to yourself, be true to yourself, and you know, and narrow down and apply to things that you know, fits you. Make sure, unless there's a genuine reason, you submit as soon as possible when the application open up, and kind of you're supposed to do. But the do or die time, you should take a note today, is September 24th, 2025. September 24th 2025 is the day the medical students deans in the deans of the medical schools here in the US will release their MSPE letters. So when they release that, starting from the next day, September 25th, that's when programs start reviewing applicants. So we don't review applicants until the MSPs are released. So if whatever application you are doing, you want to hit and make sure you don't miss any deadline. Make sure before September, you build the September 24 and be there with the deans as they are releasing their MSP letters. This is when, of course, the evaluation starts. That's what I was saying. And of course, if you submit late, you can submit late. But most people will have downloaded the application. They are looking at them. So they have to go again for you to kind of be included in the application. We have limited slots for interview, because remember, you are working and you are doing your interview. And so we have limited slots, and so it's competitive out there. So make sure you don't sabotage yourself by bringing in your application later than the release of MSP letters. Now, this year, I added this slide for this year. Residents are using Thalamus. We are using Thalamus for review once people go through errors. And one of the things they are doing now in errors is they give signals. I know for internal medicine, people get 15 signals, of which 3 are gold and 12 are silver. Gold, it means like, I really love you so much. And silver means I love you. And when we don't give signal, it's like, you know what, I'm applying here. So I will like to hear from last year applicants, how they made use of their signals, some tips you can get. Make sure you use your signals and use them wisely. I say, like, you spread them. When they apply for college here, I heard it from my daughter when she was applying for college, like, you have your dream school, and then you have your rich school, and then you have your safety school. And the same way should be for the program. You have your dream program. I want to go to this program. And then I have programs which I think they might accept me. And then I have programs which I think definitely they'll accept me. And that's how it goes when they apply for college. But the same concept, you can have it in your head, the way you rank it. And don't use your gold for all your dreams programs. Because, I mean, you might tickle badly the people who are kind of, you think you are rich, and they'll see like you have 15 signals and did you use for me? I know programs which they don't interview people who don't signal them, so because they think if you use your resources, then you're considering us highly, and then we should consider you seriously. So it's all like, these electronic errors and everything else. For interview, prepare well for your interview. Either seasoned or a rookie in the interview, you have to prepare. Show your best foot forward. Research about the program before the interview day. Make sure you know the program in and out. Create questions to ask. Serious questions shows your demonstration of interest, that you have researched about the program. As you think of questions, don't just ask questions, because if you ask questions, kind of fake questions, it will backfire on you. You'll seem like somebody who is a pest and you don't know what you're talking about. Most programs, when you're going for interview, the program director will kind of give an overview of the program. Listen carefully. The thing we hate most is a thing which we had a slide on and we talked about. Somebody asks you exactly what you talked about. It's like, were you really listening? So if you cannot listen to my presentation, will you listen to my teaching? So it kind of sounds bad on you. But if you have done your work, you have read about the program, you will know even the things that the program director is presenting. You will know you have found an area of things that you can ask that will kind of, make you stand out like somebody is really, interested in this. Speak loud, be bold, be human, what we look at when we interviewing you, can I relate with you? Or you're just stoic, you're a robot, you're a nerd, you're not personable. So try to be you, just be you. Stay engaged and interested, I can't tell you, people will be in the Zoom and you can see through the reflections of the camera, they're on their phone, and it shows you're not interested. So even if you get 30 interviews, interview for every interview Go to every interview as the only one that you have. That's the attitude you should have. If you don't learn anything today about interview, is never mind how many interviews you get, go to every interview as the only interview you have, which means you give it your all. If you show any sign of not having interest, of arrogance, that is a red flag in red. I put it in red. And most likely, nobody will rank you. So if you don't get anything from this, when you get interview, take every interview as the only interview you have. Give it your all. That's it. Make sure, you have good internet connection. I mean, if you are interviewing from East Africa, really, power can be an issue. Make sure you have backup. Your internet is good. Avoid as much distraction as you can. Make sure there's the skill to zoom in. The way you see me here, I have almost 2 lights on me. So you'll be surprised. Somebody will be on Zoom and they appear like a shade, like a silhouette of somebody. Like you're reading an X-ray looking at somebody's picture. So try to kind of master the etiquette of Zoom. Buy some extra lights. Ensure that you have a nice presentation, a place where you're going to take your interview and you can present yourself well. And that is very, very important. Can go a long way forward. Most residence programs have a lot of information in the website. So if you do your homework well, you will see those information and you will avoid asking obvious things which are there. Of course, they provide overview. So one thing is the Accreditation Commission for Graduate Medical Education, the body that oversees residence medical education, GME in the US, has a red tap that a resident can not work more than 8 hours a week. So anybody who asks any question about number of calls, the hours is gonna work, that's a big red flag. We consider you like you're not ready to do it. And frankly speaking, you don't need to ask that question because you are capped at 8 hours. And that's it. And most people will do 50 to 60 hours. And in real sense, I remember when I was doing my internship in Muhimbili, I'll go to the labor ward on Friday and come out on Monday. You can imagine how many hours continuously. Here in the US, once you work like 24, you need a break of more, I think, than 80 hours before you start another work shift. So there's no way you can do back to back. So you can do day, do overnight, and then before 10, 11, you have to leave and you will be out before you come again the next day. So every program, if ever they go above the 8 hours and every resident enters their hours consistently, if we've seen people are going above 80 consistent, and this is 80 hours averaged over a month. So you can have a week where you do 100 and then you do 50 and then you do 50, you do 40. When you average them, it comes to less than 80. If goes above 80, they get reprimanded. So somebody is protecting you. You don't need to go there. Don't go there. Don't ask. Don't tell. Most programs has a clause that communication is not necessary post-graduation, post-interview. So, but if you have a genuine question to ask, is ask. And one of the things which I found to be very nice is if you do step 3 between interview and submission of the rank order list, you can email the program directly and let them know, I passed my step 3, I'm still interested on the program, I'm highly considering you. And that's why we tell you, like, you guys, you need to try to do step 3 to kind of enhance your chances. So once in a while, genuine specific question going in is not real bad, but just observe what's the etiquette and make sure you do it well. When you finish interviewing now, you have to create your rank order list. And this is done now in NRMP, National Residence Matching Program. So as soon as you finish your interviews, create your rank order list. And you create it and you certify it immediately. You can continue to edit it as you continue up to the deadline. Why do I do this? Why do I tell people to do this? Just in case something happens, you are hit by border and you go unconscious. When you wake up after a match, you find that you matched. Because if you didn't submit your list, there's no way you can match. So there's no need of taking any risk. The moment you finish your interviews, create your rank order list, certify it, and then keep thinking about it, modify, certify again, modify, certify again till deadline. You can certify even 100 times, but don't leave it kind of you're procrastinating. I'm figuring, should I put this first or second? I mean, just put whatever it is, certify it, and keep changing it as you move along. So you can submit it as much as possible. So what I want you to understand through the National Residence Matching Program is they really consider your choice first before they consider the program first. Let's say you spoke to, your brother is a program director in a program, let's say Boston Pediatrics is your brother. And your brother told you that I will rank you to match. And then you had 12 other interviews, and there are other programs which are stronger than your brother, which are aligned to the things that you want. You can rank the programs that you like most yourself, first, second, whatever, and put your brother's program as number 12. So although he put you as number 1 in his program, if any of the programs that you like more than his program put you in a ranker, in a matching position, you will go to those programs. But if they don't, although you put them as number 12, NRMP will not let you go unmatched and it will give you your brother's slot. So what I want to say is don't rank because you think these people are more likely to rank me. Rank the way you like them. So I'll tell I think Abibu and Magacha can attest to this. I said, you want to do fellowship. Rank first the university programs because they are more academical associated. You have more high chances of going to the highly coveted fellowships. And so put them top and then put the community programs down. So in case they don't take you, then you end up going there. You will match anyway. So you won't stop matching to a program because you ranked them low. That's the bottom line of that explanation. In conclusion, you have to create a well thought of strong application. You have to research all programs very well. Ensure you have not less than 3 reference letters and make sure you submit in time. And the time for this year is September 24th. Make sure you submit before September 24th. And of course, when you're submitting the application now, there's a deaf silence between submission and start hearing about the interviews. Don't lose heart and start panicking because the program, somebody will submit, let's say NRMP open on September 1st and somebody submit on September 1st and then September 21st is calling you like, I've not had any interview. I read online, people have 3 interviews. Those are liars. There's no program that looks at applicants before the MSP are released. So, but people are playing psychological warfare. Oh, I have 3 interviews already to kind of scare you and make you feel uneasy. And you think those are the psychological warfares going around. So there's some kind of silence that goes through. Roland is coming in. There's some kind of silence that goes through. And so that's really common. Just wait, see, you have done your job. Wait for the things to unfold. So when you're invited for interview, schedule as soon as possible, as soon as you can. Read about the program extensively. Show up on the interview day, confident, prepared, shine. It's your moment to shine. Give it 101%, And immediately when your NRMP open up, create your ranking order list and certify it. I can't overemphasize. Certify it and continue certifying, recertifying, and certifying again as you get more information and shovel your programs around. So when you do it and you do it well, around the second week of March on Monday, you'll get this magical email with the 3 sweetest words I've ever known. Congratulations, you have matched. It's the most amazing feeling, and by Friday that week, where you're going. Let us know. We want to see all those things. And and this year we had almost more than 9,700 IMGs matching the program. And in the middle, I'm showing graphically the percentage of applicants, the number of applicants and those who matched. So they are around 60%. And then you can see you know, for J1 physician. So they mean J1 physician, this is interhealth. J1 physician, it means the IMG, non-American IMGs. Because, you know, you can be American citizen and be an IMG. IMG is just an educational kind of status. You train in the medical school in the continental US or outside continental US. So you have American IMGs, you have international IMGs. So non-American IMGs, 54% margin in internal medicine. Then you can see those proportion for pediatric, family medicine, neurology, surgery, other specialty, that's 16%. It means that's where you have ortho, neurosurgery, you have everything, pathology, grouped together, even psychiatry is in there, you know? So it's an euphoric kind of look at the stats, look at things, you know, make your choice wisely. It's gratifying. I can remember exactly where I was when I got the message that I matched. It's a feeling that, you know, you will die with it. You cannot shake it off your brain. So good luck in your application. Hope to see you all in the panel. I mean, you guys who are applying this year. In November, I really like to bring the people who are interviewing among you guys. And, you know, I can boast that all the people who have been my panelists, the 100% has matched so far. You know, so it's exciting. Those people remember to give back. It's really, really important. I mean, as I said, I kind of strongly said, you know, we are there to help you, and we want you to help others. That's the real thing we are looking forward to. And nobody between you applicants is competing with you. Help everybody equally. Somebody's applying neurology, you're applying pediatrics, completely different thing. So nobody is competing with you. You are really competing against yourself. You against you, nothing else. So it's very important to be open-minded, you know, and to help people. And as I said, for all of you, once you get ECFMG certified, send an email to USMLE Pursuit that you are ECFMG certified. And I'm okay. I can share my phone number with you if you don't have already. We can be on one-to-one. You're now colleague. You are looking forward. It's just a matter of time, you know, before you come on board. And of course, I want you to pay it back. I really expect the people who goes through these channels, it's expected of you, you know, to step up, to be on these kind of forums and help other people. You know, this year we had two separate programs, one for TAMSA, separate from the usual series, and one for University of Nairobi. But next year I can tell them, hey, speak to Nunex, is your alumni here? Or Kenyatta they want, I say, you know, speak to so-and-so is from Kenyatta, and you guys, you can be there, you can step in and provide more mentorship and kind of, you know, help people navigate through the system. So this is USMLE Pursuit kind of database. You know, my matched applicant, this is my magic number. It's growing. I think I have now 12 people who have gone through, recorded here as matched. I think I have like 20 people who have done step 1. I have like 5 here who are ECFMG certified. And once you match, I remove from all other groups and I just keep you in the matched to keep a thing. I have a magic number in my head, which I said, God, before I retire, I want this XY number of people to have gone through GME, where in one way or another, I have my hand on it. So when you get ECFMG certified, you are near my goal to satisfy my personal goal, but also to reach your dream. And so it's exciting moment. And this was from last year. She was one of our panelists. She really worked with us with all 3 sessions. Moza from Mombasa, Kenya. She's now PGY1 in internal medicine in California, you know, and in July, she'll be resident. She'll be PGY2. So I'm looking forward for you applicants to get these kind of pictures so that I can update my slides and kind of have most current information as we go ahead. So thank you, everybody. We wish you luck. We'll open the forum up for question.
Thank you.
I will stop the share and, you know, we can
thank you
see
so
each
much,
other and talk.
Dr.
Yeah.
Ignas. Thank you so much. A great presentation as always, like full of information. I'm really hoping the participants will open up and have a lot of questions. And again, I want to emphasize the importance of everybody giving back. It's really, really critical. I guess maybe in our countries, people are not used to volunteering. We're very much used to competing. So this thing of like, what is Ignas having? Is Ignas getting commission whenever these graduates or something? So I think there's a little bit of a culture where we don't have that. And I just want to share my screen briefly to kind of illustrate how you guys may help us. So very briefly here, this is the Ministry of Health website in TZ. And I was poking around for one reason or another, and there is a case that is actually listed here. I'm hoping some of you will go and click in. It's a case report that was reported from one of the regional hospitals in Tanzania. It's a maternal death, 45-year-old who basically passed away after delivering twins. To me, basically brought the whole thing of like, basically, there are many, many gaps in this case. And I highly encourage all of you to go and look in there and just imagine, like, if this patient showed up at one of your hospitals here in the US, what would have been the workup and so forth. Needless to say, there was no x-ray, there were no like pulse ox, none of that was done. And the patient basically showed up already in cardiac arrest, even though they had shown up to the hospital and basically was diagnosed with like gastric reflux. And the sad thing for me as a radiologist, it actually took pathology to basically go and basically open up an autopsy to figure out that this patient aspirated as part of the thing. I think it's probably she had aspiration pneumonia, if you ask me, as that made it be the major differential. But my point is, I am hoping as Ignas's number increases, we will be able to begin to tackle some of these issues of both improving medical education for ourselves, but also improving medical education on the continent. Because that 45-year-old female could be your aunt, could be your sister, could be anybody in your circle, could actually have this exact same outcome. So it's not really a sort of I want to make sure this is not sort of like an exercise, I think an exercise. These are real people and real patients. And it happens to me time and time again. I have relatives who come in, had a head bleed, and with a blood pressure of 240. And at the same time, they're not measuring blood pressure like, like routinely. It's not every 4 hours, every 6 hours. I had to kind of emphasize that they really have to monitor blood pressure. They have to go get IV blood pressure medication. And with all of that, I'm happy to say that the patient is still alive with us. But I knew that if they didn't have that kind of input, 48 hours, they'll be dead, basically. This is like standard, sort of like, hypertensive head bleed without managing the blood pressure. My point is, this is not a theoretical exercise. And so even though many of you will come here and great, we're very well paid and remunerated, I want to make sure that you always remember that we're dealing with real patients. And many of you may become patients in those systems. So it's not really about passing exams only, it's really about being a good physician. So that's a very important point. And really that's the reason why we're doing this. So I just want to kind of share that example to kind of remind you, because sometimes, when in these environments, you kind of forget that these are sort of the outcomes that are happening day in, day out. I'm sure there are probably another like 10, 15 mothers who are kind of hitting this similar outcome on a daily basis. And then basically, buona metua, life goes on and so forth. The twins will kind of grow up without a mother and so forth. All right, not to put you guys on a downer, but I just wanted to kind of make sure we have a reality check and kind of give a 360. And that's one of the reasons I'm very much involved in some of the training in Tanzania, because I'm very much aware that should I have a stroke in Tanzania, I'm going to basically suffer natural history, meaning I will be able to read my CTA and say there's an MCA occlusion, but nobody's going to be able to do anything about that. And I know many cases where that is actually a reality. And by the way, it's not a reality just for Frank Mincha. This includes everybody in Tanzania. It doesn't matter how many billions of dollars you have. You're not going to be able to get out of Tanzania to India, to South Africa, whatever. The point is, we have to build those care systems at home. We have to build those care systems at home. And the USGME, to me, is just one way in which you can gain that education, but also you can get remunerated while you're at it. So that's the great thing about it. You're getting paid to like learn, and then once you're kind of like, you know, making your money, you can decide whether you want to spend your life moonlighting or you want to do things besides moonlighting, including like, you know, training or maybe starting hospitals at home and so forth. So I just wanted to kind of like, you know, inject that into this conversation, because many people are like, oh, why are you guys talking about brain drain and blah blah blah, you know, why are you taking like the best and brightest and bringing them to the US? Basically all of the countries that have good hospital systems, meaning South Korea, meaning Philippines, meaning India, meaning Turkey, all of them basically use diaspora to basically go recharge those hospitals. Many of those people started those major medical centers, trained in the US and the UK, and went back and basically built those systems. So you have to train somewhere. And it just, America happens to be one great place to train and a very mature training systems and so forth. So it's really about brain circulation. And please don't try to get trapped in this like nonsense of brain drain and whatever. We never talk about like, you know, soccer drain when people go and play for like Arsenal or whatever. Nobody like whines about, I can't believe like so-and-so Didier Drogba has gone to like the UK, like Ivory Coast is gonna suffer. But suddenly Frank Mincha comes to the Emery, there's like a lot of noise about you're depriving Muimbili of it. And meanwhile, I'm reading all cases from Muimbili like on a weekly basis. All right, enough pontification. This is to open up the floor. Please open up and ask a lot of questions. So please, I want to make sure we flip it such that if there's a burning question, we address that, and then we start to invite our panelists. So if somebody has a burning question that they showed up here and they have that question, let's make sure you guys have a chance to answer that. And then Dr. Ignas, you can start to invite our panelists for like, you know, 2-3 minute comments and so forth. Yamani karibuni. And at this point, feel free to ask in English or Swahili. I think Zoom AI probably has captured most of the things that we want to get across. So feel free to unmute or raise your hand so we can kind of get the discussion going. And by the way, we will stop on the hour. So just in case you're hoping to ask in the last 5 minutes of the session. So we have another 15 minutes to kind of bring this to a close. Back to you, Dr. Kola. If there are no questions, you can just start inviting the panelists. Karibu.
Okay, I mean, let's give them 1, 2, 3 minutes. Yeah, so Nunex, Eligape, and for those people who joined a little bit late, so we have 3 people who matched this match, who are starting PGY1 in July. Nunex Mongare from University of Nairobi, from Kenya. God bless from Tanzania, is in Arusha Lutheran Medical Center, and Eligape Urasa from KSMC, also from Tanzania. Ashabila, I see you raise your hand. Welcome, unmute and ask your questions, and we'll have, you know, everybody chip in appropriately.
Thank you. Thank you so much, Dr. James. Thank you for the talk, and as always, thank you for the guidance. My question is on publications. I'm hoping to go in Dr. Nunex's direction of taking neurology. I'm very impressed with his publications, which all seem to be in neurology. I have a few publications. One or two are in neuro, so others are in different fields. Is this? I mean, I know it's not as strong, but is this enough, or should I now start looking for maybe case studies to work on from Tanzania?
I mean, whatever you can get in, the more the merrier. But I mean, frankly speaking, you know, I've seen people get in without even publication. But what I said, when you have a publication, it shows you can start something and finish. It's May, your application is coming in September. How much can you squeeze in? You're also doing observership, you're doing other things. So you can get more, well and fine, but not at the expenses of delaying your application or some having a substandard application. I don't know. Anyone else who
Absolutely. I mean, the point is, nobody is expecting you to be a neurologist and to have like 10 neurology papers. If you have something in neurology, that's great. But as Dr. Ignas said, publications are basically proof of follow through. Okay. Likewise, passing your exams is just an indication that you're able to sit down and do the work required to pass these exams. right? So that's really the indication, because when you join training, as Dr. Ignas had alluded before, the most important thing is for you not to quit. Because when you quit, you basically really destroy everybody's training, right? So now a program was gonna go from Q4 to Q3 call. That's horrendous, right? Or the program was Q3, now goes to Q2 because you decided that for whatever reason you try to like stop in the middle of the training. So basically publications are really evidence, you know, you've done some scholarly work, but most importantly shows your level of commitment, because many publications require multiple revisions, requires persistence, requires a self-initiative. So it has those qualities, if you will, that are also good for residency training. But maybe Nunex can give some clues as to how he was able to get several publications under his belt. Maybe there's a system that they're using at Aga Khan that may be good for us to kind of know about. Karibu Nunex.
Thank you, everyone. This is such a wonderful introduction to our talk. Shabilan, thank you for choosing neurology. So that's a brilliant choice. Well, I must say they've already answered some of the things that I was going to say. But as I think about my application process, there are things that are happening in the background that may not come to the fore when you just look at the list of publications that are next to my name. For example, most of my stroke publications had actually not come out by the time I was doing my application last year. Most of them did come out later this year. So it did not play the biggest of roles when I was applying last year. The few that I had to my name did show what Frank has mentioned. They just want to see that you're able to follow through, that you're able to commit to something and show something of it at the very end. The other thing that I would add is during my whole application process, during my whole interview process, nobody brought up my publications. Nobody, commented on it and said, "Oh, we're impressed by the number of publications that you have against your name." What they did is they asked about my experiences. They wanted to know my stories. They wanted to know about, why do you enjoy research? Why did you do this particular topic? So nobody will look at the number of publications or the 20 publications that you have or the 10 or 100. They want to see, they want the story. They want the background more than the data or the numbers. I hope that answers the question.
Awesome, that's great. Maybe we can take this opportunity, Nunex, you can just elaborate a little bit more about your journey. And I think there was some, James, you wanted them to comment on how they use their tokens, right? Like the signal.
There's a question coming from Bigemana. I think we'll take it, and then we can ask the newly matched about their experience. When they tell us, they'll take it into consideration when they tell us about their experience. Bigemana, you can go ahead and ask your question. I saw you raise your hand. Probably her internet is not good. If you come again, okay, you're unmuted. Oh no.
Can everybody hear me?
Yes.
All right. Thank you for the opportunity you guys are giving us. We appreciate the work you put in helping. I was just wondering if somebody went unmatched from the concluded cycle, does that affect anyhow the chances of them matching in the coming cycles? I mean, like lowering their chances. I'm just wondering and curious about it. And is there a way maybe you can put it to defend it, let's say in your personal statement, trying to justify or telling maybe why you think you didn't match, and if there are things you have improved that you think there were the reasons that put you back?
So to answer your question, because that's what I do, absolutely no. The only thing that is against you is you are year after, you're not getting any younger. So you're one more year on top of what you are last year from your application. So in terms of somebody is applying, I mean, it's not uncommon. I found people who applied, they matched in their third, in their fourth cycle of application. So there's no carryover. You should not explain about it in your personal statement. Just talk about you, talk about things that you think can be catchy and your love for medicine, and that's it. So yeah, that will be my thing. So the only thing is just it's getting more years, but you don't need to talk about it. I don't think it's affecting in any other way possible. It's a lot of things we know. I mean, applying is not cheap. So it's not that the fact that you are ECFMG certified that you expect to put your application in. So, and definitely we don't really, after looking at the year of graduation, we don't care. Like, when did you do step 2? We don't go into those things. You're ECFMG certified. You are this, you are coming on this spot. We talk about it and we move forward. So that's my take. And that's what we do. Yeah, I'm 100% sure on that. Tindwa, you raised your hand. You can ask your question. If you have a follow-up question, let us know. You can just go. You can write it in the chat, or you can talk again. That's fine. Bigeman, are you okay before Tindwa speaks?
Yeah, absolutely. Thank you for the response.
Okay. Tindwa, go.
Yeah. Morning, everybody. Thanks for the talk. Thanks for all the information you've provided to us. My question is about LOR, the letters of recommendation in particular. Like, I would like to know what makes them, let's say, particularly strong, because sometimes I've heard of, let's say, you get a chance to do observership or a chance to rotate with a physician, and then they'll tell you maybe write for me the letter that you would like, or I mean, show me a brief example of what you want so I can write to you. So I want to know how to avoid making mistakes of generic letter. Like, what do we need to have in our letters of recommendations or anything to make them particularly strong for the application?
Okay, so I will
Yeah.
answer it and then I'll let other people chip in if any of the panelists have any ideas. People are coming from doing reference letters. So the key thing is, first and foremost, I would like to recommend that you waiver your right to see your reference letter. So in the US, there is this law on medical education whereby you can decide you want to see the reference letter that somebody submits for you. ERAS has a clause whereby you check the box, you have waived your right to see that. Even if the person asks you to do the draft, you waiver your right because they'll have to upload it from their email. So that shows like, you waived your right, whatever it is. So the key thing is, in the British system, our letters are very brief. I know James is a good person, professor, or so-and-so. That's the way we write it. American system is different. It's somebody will write almost a full page of information about, about you. And that's how we enthusiastic, and that's what is expected. So we have a cultural shock and cultural difference, which you have to really address if you are coming from the British system. So if somebody asks you to kind of give them a scheme, because it will be talking about your strength and everything, you can draft it, give it to them, but the final will be coming from them. So I see, for somebody who has not been writing within this system, to kind of jeopardize in your application, because we'll think by saying, Tindwa is a very good physician, is excellent, is fantastic, hire him, Professor Mabwepande,
But that's also why it's important to have American-trained people to write your letters of recommendation, right? So that's at least 2 of your 3 letters have to come from the American system or somebody. I mean, and to add to that, a great source sometimes can be volunteers. I always say this: we send a lot of volunteer faculty to East Africa, and they're there. If you're like really super engaged and you're really engaged in whatever they're doing, and you make a good connection, they can be a really good letter writers, because they also understand the Tanzanian context and they understand the American context. So then they can basically put you vis-a-vis your peer cohort, because you know what, he really stood out compared to however many are like hundreds of medical students or trainees or other like physicians I've seen in Tanzania or Kenya, Uganda, and whatnot. So I do find that folks have been to our countries and the American can really have a good perspective, because they sort of see, they can translate what does this mean. Like you may have a good performance from Wimbili, but then it's very difficult for people to really sort of understand what does that mean vis-a-vis the U.S. System. So just I can't emphasize enough making sure one or two of those letters is coming from somebody with U.S. experience.
Yeah, and that's why I think when the letters I wrote Americans, either here or outside. And I mean, it might be late for the people who are already applying in September, but we talk about this when we talk about one-on-one and 201, being intentional, following up those collaborators coming, stepping up, interacting with them, getting them to know you, expressing your interest, working with them, helping them out. No good deed goes unpaid. So we have had a guy who is a neurologist now in Augusta, Georgia. He literally matched in neurology from Barara because he met a neurologist in Barara and he was interested in neurology. And so they started talking, they engaged and say, do your USMLE, I will offer you a spot. And that's where he really matched at the program where the guy was coming from. And, he has done neurocritical care and EEG, is practicing now, attending in Augusta. And, so it's personal connection is very important. You have to connect and be personable. That's the key thing in all this process.
Yeah, I also have an experience that I'd like to share. So at the beginning of last year, there's this multi-center collaborative study that Aga Khan was taking part in, and I was simply helping my professor. His name is Professor Soki, with data collection, and I did a good job, and Professor Soki wrote to the lead author and said, I have my resident here. He's done a really good job incorporating him in authorship. It was a great paper, big paper, and from that research work, we had other sub-analyses that we were planning on being published. So it was this email thread where the lead author would ask maybe 500, or rather we were about 100 of us, how many of us would like to be on the paper? And you just reply and say, I'm interested. In one of the sub-analysis, he only needed 50 co-authors to be present. And by the time he was telling us that, about 70 of us had shown interest. So, I was maybe number 55 or 51. So I emailed him and said, hi, Prof. We've been working on this study together. I realize I'm on number 55, so I would like to remove my name as a co-author. But instead, I think you should know that I'm applying for neurology residency this year, and it would be great if you could support me in any way. He replied immediately and said, of all the co-authors, I was the only person who was willing to have my name redacted as a co-author. And he was so amazed and impressed by that. And immediately he offered to write me a recommendation letter, simply from that simple act of being willing to let go of authorship so that I could be assisted in this other way. And in fact, at the end of it, he still added me as one of the 50 authors. Just this goes on to show or say that there are people there who are willing to help, but they want to see a person. All of us are amazing at this. All of us have passed our STEP exams. All of us are brilliant from wherever we come from. Me from Nakuru, someone from Tanzania. All of us are we're the top of the top wherever we come from. We have passed our medical school exams and will definitely flourish in America. But we need to show that we are human beings. We need to show the person interviewing us, this is someone who I can hang out with. This is someone who I can welcome to my home beyond simply being in the hospital or being in the office. And they want to see that, as you mentioned, personability. They want to see that this is a human being. And I must say that is the hardest part, but also the easiest part.
I want to share, Nunex, that was a really gangster move. And that was basically also described in this book, which I'll highly recommend for all people, is Dale Carnegie, How to Win Friends and Influence People. It's a highly, highly recommended classic book for business people. But basically it talks about solving other people's problems first, all right? So basically, you kind of when you approached him, you solved his problem, which is like, how am I going to prune all these authors? And you basically volunteer because now he has a problem, right? So he said, I only need 50. And now you have like 70 people. Now, shoot, how do I say no to it? So you basically solve this problem. And then you offered him an open-ended, assist me in some way. You didn't say, write me a letter. You didn't say, like, please invite me to your lab. You didn't say, my whatever, I need school fees, blah, blah, blah. Some like usual, like, problematic African problems. It's like, my child is this and that. It's like, dude, it's like you turn people out. But I just want to really use that example. And this book has many, many more examples of that. It's basically this whole game of basically, again, you're solving the program's problem, right? So the program wants to say, how are you going to help us? Right? So many times, like, I'm the best resident. No, I'm the best medical. They don't care. It's like, understand, what is James's problem? He needs people to work call, like, whatever, like 15, 20 weekends a year. That's his problem. How are you going to solve that? And once you can sort of address that and show that you're willing to kind of like, step in those shoes, I think it can really, really help. So I just thank you for sharing that. It's a very practical nugget. And to me, it just really resonated because I literally just read about this like a few days ago. I was like, man, you guys are applying like ancient wisdom. Hongera-san.
Thank you.
Thank you, Munix. Eligap, you are raising your question, your hand. You can go ahead and.
Yeah, I was just trying to share my experience in the past cycle that I just went through. When it came to the point of letters of recommendation from my end, what I did is I made sure that whomsoever is going to, because I honestly used some letters from Tanzania, like one from internal medicine and one from pediatrics. But what I did was these people didn't have any idea of what to do with this letter of recommendation and something. So I had to sit down with them and tell them this is what is needed. These are the examples of the letters that, are good letters of recommendation, and this is how it should be. And in the end, they wrote me those letters. I waived the letters, and I made sure that these letters were really strong because they're not from US or they're not in the US system. So how are these letters going to appear strong? I made sure that this is the head of department, and the letter was titled correctly, that this is the chair of the department, so and so, and it's addressing the right department in particular. So I think even during the interviews, these people commented, they say, oh, the head of department from KCMC in the pediatric department, they wrote you a very strong letter. I think this is why we're interviewing you today. So I think it matters who writes it. If it's the head of department, then that's good. If it's like a principal investigator in a study that you're working on and something, it's probably a strong letter. But if it's just a physician who doesn't have any position and they're not in the US, probably it will be to your disadvantage because it doesn't have weight. Because when you're filling in the letters of recommendation in the ERAS, they ask you, who is this person? Is this head of department? Is it the chair of the department? Or is it just any physician? So I think it matters when it comes to letters outside the US, they should be written by a physician who holds a certain position, at least, in my opinion.
Just one thing to add on that. I think when you're asking for a letter of recommendation from somebody, you should ask a letter from somebody who you work with, who knows you very well, knows your work ethics, not just because that you know somebody or you are friends, like, oh, I know this guy is the head of department from somewhere in the US, can write me a letter of recommendation. You never work with them. They don't really know you well. They don't know what your work ethics. So what kind of letter of recommendation do you expect them to like? It's just gonna be a general letter of recommendation. So I would advise you, if you're reaching out for somebody to write your letter of recommendation, you ask somebody who you guys have worked together and he knows you very well. He can write a letter which is specifically like for you based on what your work ethics and how he knows you. So that would be my own recommendation on that.
Sorry, and I just wanted to add something. And I forgot to just share my experience with the research part because when I was applying, I had many publications also, like in internal medicine and pediatrics, some in surgery, some in obstetrics and gynecology. And I was wondering whether these research experiences are really going to count I anyway just listed them there because the story was you should write, you should put your publications on a department that you're applying for. That was the myth. But what I did is I just listed everything that I had published. And then these people asked me, what is your, I mean, we see that you, some programs asked me, okay, we see that you've published some papers. Can you tell us about one particular paper that really you think you learned the most from it and something like that? So I took the pediatrics papers instead. So I didn't speak about my surgery or obstetrics and gynecology. I chose my paper from adolescents and I spoke about it, and they were really impressed. So sometimes it's okay to have many other papers from other departments, but when they ask you, look for something that is relevant to that department that you're trying to apply for. And I think that will work wonders for you.
And you know you are working well and know how to articulate it quickly and sell it in a way that, you know, you're trying to create memories in people's brain. Like they continue remembering this, I really want this guy, you know. It's like courtship. God bless. Can you give us a few words of advice? And
So, hi everyone. So in regard to letters of recommendation, actually I had like, I think 5 letters of recommendation, but you can put maximum 4. So I did like allocate some letters of recommendation like for a particular program. The thing is that one IMG from Cameroon, she advised me that, you know, when you're asking for letters of recommendation, ask, can you write me a strong letter of recommendation? And I had people like after working with them for like a week during my extension time, they told me, you know, like my position is so junior. I'm like a newly hired attending. I don't think I'm a right person. So I had like some rejection. But I also had some people who were like, you know, heads of department people who had established like a little bit of a long relationship with, who agreed to write me the letters of recommendation. So I think the main thing is like ask them to write you like a strong letters of recommendation. Like, can you write me a strong letter of recommendation? And if probably the US physician, they know how to write it. So I think that will be like a good tip on how you can get them done. The other thing is that for personal statement, the technique that I use, I was focused in one area. So let's say for me, I wanted pediatrics. Graduated 5 years ago, and all these 5 years I've been working in pediatrics. So like everything in my personal statement, in my whole application, it just screamed pediatrics. It was focused in that area, and that I only applied to pediatrics. So I think that helps in like at least show them that you're more focused as compared to if you are just partial, you're not like anywhere. So that I think that also helps. And then the other thing also during the interview. So my interview questions, they were all experienced, clinical experienced. The advantage that I think IMG has as compared to US graduate is because you have, let's say, 3-4 years of clinical experience. When they ask you a question like, you know, how did you resolve a conflict at workplace? How did you do 1, 2, 3? You can use live examples to your workplace. And then you can show them how things are done in Tanzania and everything. And that gives like a new perspective that they may not have, which I think it's a good thing in the interviews. And it's an advantage that an AMG has as compared to a fresh graduate student. And let me just finish all the points. So on the part of the signals, I did not know anything about the signals. Nobody told me anything about the signals. I just found them there. So on my application, I graded the programs into 3 categories. They were far-reach programs. They were kind of the middle one, and they were like comfort zone. So I went to FREDA and Doximity, and then I looked on the ranking, and then I graded them. And then I had 5 signals for pediatrics. So I gave 3 to my high reach program and gave 2 to my like middle level program. That's all I did. And I got, I think out of 5, 4 of the places that I signal I got an interview. So I think they really play like a good, you know, give you like a good maximum chance for you getting an interview, because the main thing that you need, apart from like the scores, everything is to make your application appealing for people to call you for interviews, and then you can show them like the real person you are. And the main thing I think they look for in an interview is how interested you are, as Dr. Kola said. So my advice, you are an IMG, attend everything, like from the open house event, like, from now, like start looking at the programs and everything, follow them on social medias, like their comment and everything, attend their open house events, which they usually are like on July, like to start show interest, ask questions, ask meaningful questions, so that at least people start knowing your name and everything. And when they do those like pre-interview meetup and everything, even if they're say optional, you just attend, be engageful, and ask questions, so that at least people know you. You can put a joke, like one of the things that started the conversation was the timeline difference, because for them, like those evening socials were like midnight for me. So I'll be like, hey, I'm God bless from Tanzania. It's like 3 a.m. here. So, that's at least spark your name in people's brain. Like there was someone who joined at 3 a.m. from Tanzania. It's like, or like from Africa or some other countries. So I think that's one of the main things to do. The other thing that people get a little bit caught up, applicant, is letters of intent. Like after interview, people like, should I send letters of intent? Should I not? I just updated them on my step 3 result. I did not send any letters of intent, but it can be a little bit crazy and like pressured to do so, but like do what works for you. And the other thing is that, one step at a time. It can be, you might feel like you have, there's not enough thinking about ranking right now because you're not even going through the interviews. I would say like, okay, fine, stick to the step 2, start preparing your application, write your personal statement, give people to read. I had gave people my personal statement that they pointed out like grammar errors and everything, which I had not seen before. Like, make a timeline and stick to your timeline, and also like engage people and ask like, is this okay? How can I move? But you don't need to worry about ranking right now while you've not even done, let's say, step 2, or like you've not even sent the application. And one of the tips I got from a US graduate on the application part. So she advised me the date they open the window. So, that they're going to open the window the 4th of September. So probably you've already prepare everything on your errors, everything is ready. They told me that the day they open the window, send your application. Because when your application is released, it's going to be at least on the top, let's say, 50, 100, as compared to you waiting and submitting it at nearly the end. Maybe Dr. Kola can say much about it, but they did advise me on that. And I applied to a good number of programs and like send everything and pay for everything on when just the window opened. And then on the day after, got an advice on like, all of your programs, they're like a little bit of a fire reach, like applied to like more comfort program and everything, and applied to like 5 more comfort program on the 2nd, 3rd day. And I had nothing from the one that I applied later, and I only had for the one that I submitted in the beginning. So I think maybe that plays a part. Dr. Kola will know more, but I would say like, just do your timeline, one thing at a time, and try to be focused. Thank you.
God bless. Those are real key points. I hope, guys, you are soaking in. Please go and listen again to this recording. He gave like money. In terms of you applying on the 4th or on the 22nd of September, in real sense, I don't know. I think in errors, I'm in errors. We just download them in batches. So the key thing, which I don't think, if they'll go there, you can sort them alphabetically or by date of submission, but I don't think it will limit. I mean, if you can do, you are ready, go ahead and do it. But my hard stop is make sure you submit before MSP date is released. I Googled it. So see the MSP release date and make sure you submit before that. That's the key thing. That's the deadline, I know. But the rest, God bless, your points are very interesting. How many programs do you apply to? And if you don't mind, how many interviews did you get?
My case is a little bit different as compared to most other cases. Actually, from the 101, the one that I attended, and then, you and Dr. Minja, I asked a question about like the timeline and everything. Initially, I had my own timeline, and then everyone was like saying use 6 months and everything. I did everything step 1, step 2, step 3 in 1 year, which was a foolish move. I wish I had information and I'd planned earlier. So I only applied to 30 programs, but all my letters of recommendation, they are from US. I did not do observership, I did externship, which is like hands-on clinical experience in US. I had worked with like, good numbers of US physicians and everything. So I came to I had an advantage a little bit as compared to just a normal IMG. So I did not apply to like 99, 100. So there was also a money issue. So I just resolved into applying to 30. So initially I applied to 25, and then I added 5 more. And I had 8 interviews, and I ranked all of them. I did not opt to not rank a program. I ranked all of them, and I actually matched into my number 1. But I had pretty much good programs from like pediatric standpoint view. So it doesn't have to be 30. You just have to look on the case to case. What program are you applying? What amount of funds do you have? And everything, but it's case to case basis. It's not like one size fits all. And one thing that I did not really know was the interview part. So they send you interview invites. You get an email and everything. I did one mistake. I was in the clinic seeing a patient. I saw the invite. I got happy and everything. Put my phone away, do the whole consultation and everything. And then at the end of the working day, which is like 4 hours later, went in a schedule. And I found all November and December problem. The December date, they're all filled. And I did interview like at late on the January. So just for you folks who you're applying this year, when you get an interview invite email, take a moment, go out, schedule that interview, and find a date that works for you. You don't really have to do, let's say, I would not advise do 1 week, do 2 interviews unless you cannot change it. You can do maybe like weekly, or like space it a little bit more so you have time to research the program and find questions you'll ask the program that they're also like personalized questions. One question that I would like, one topic I would say that, talk about is the visa process. You're an IMG, you are with the program director. That's the right person you can ask about the visa in terms of not what is written in the website, what are resources they have to transition, how are they going to, help you and assist you in the transition process, because they can answer you that. And also one that I learned about asking this question, so there are 2 types of visa. There's like J1 and H1B. Even if they write, sometimes they offer H1B, you have to clarify. Sometimes it's only written, like they may not be able to offer some sort. So yeah, on the interview, when you get an invite, take a moment, schedule it according to how you prefer, and then continue with your work. When you wait for 2 hours, you might find the later date, which that might not be really bad because it will be on their mind close to their ranking. So, you just have to see what you want. But for the program that is like on your top tier, don't put it as number 1 interview. Put it as like this number 3, number 4. So like you're already comfortable, you're not pressured to talk, you're already used to the interview Zoom thing, you recognize the network issue and everything. So your top programs, put them like number 3, number 4, number 5. Don't put them as a practicing interview. And it's also good to have someone to practice interview with prior to your first interview date, which for me, one of the US physicians volunteered. And then we we did the practice and everything. And then I realized my network was horrible. So I chose another network company, and that worked fine. So yeah, that's all.
Oh, appreciate it, God bless. That was very informative. Thank you.
Yeah, and somebody was asking for your contact. So I think you guys we're gonna share the applicants. I mean, they will reach out and ask, and you are giving us like real material. And I think I said on the slides, I mean, you schedule as soon as possible, you know. So you went above and beyond. Even a few hours can make a big difference, you know. And another thing, please, during the interview period, have a run, see how your network works, the way God Bless did, but also don't change computers. I mean, you are used to Windows, and all of a sudden you want to interview with a Mac, it can be a disaster. So make sure you use the things that you know. It's not a time to learn new things. It's not a time to practice on your life. And please, if you interview, rank. The worst case scenario, you put it last, and that's where you will rank if you will match if you are going unmatched. When you match to your last program, it means if that program did not take you, you would have gone unmatched. You should thank them and sit down and study hard. So it's not like you are doing them a favor. So you match to a program because they are the one who take you, and the one you put on top, they didn't want you, and that's why you didn't go there. So I really hate it when you talk to like trainees and like, oh, I'm so much better. Relax. You are here with us. Yeah.
Yeah, remember the cycle begins next month on June 4th. You can get access, you can buy the token to open the ERAS application, create your account, start looking into programs, what programs you want to apply. You test every program in the ERAS, so you can get some of the information from ERAS about different programs. And on September 3rd, 23rd, I think September 3rd, you can begin submitting your applications. And September 24th, that's when Dr. Kura mentioned about MSP being released. That's when you can start getting interviews. So, and another thing is on personal statement, try the best you can. Your personal statement should just be one page. No program directors wants to read 2 pages of applicants. Maybe they have 5,000 applicants. They want to read all those 2 pages. Just try your best to make it one page. We already talked about the letters of recommendation, program choice. Make sure you choose a program or you apply to a program that you know, if I match this program, I'll be happy in that program. Don't just apply to a program that you know that I might not be happy in that area. Like for me, when I was doing my application, I was like, I don't want to go to New York. Like I would say I applied to some programs in New York, but I was like, I wouldn't be happy to live there. So I was like, all programs in New York were on the bottom, like rank list of they're on the bottom of my rank list. So just try to think where you want to go. Like I didn't apply to Hawaii because I was like, there's no way I can live there. So just try to see.
My gosh, why are you against New York? And then
No,
tell us the awesome things about Tennessee recruiting IMGs.
That's just me, because you have to think of different kind of things like life expenses in different states in the US, different cities. It's not the same because if you're in New York, there's different things that you have to accept, be able to go through. So you have to know every kind of city, every kind of programs you're applying, the location of the program. That if you don't like cold weather, you don't like the expenses, you don't like maybe the culture of that area.
Got it.
Those are the things you have to consider.
That's it. That's an important thing because people have to understand the matches are contract.
Yeah.
So wherever you match, you must go. So don't end up applying to like Nebraska and then suddenly Nebraska matches you and you're like, oh, shoot, I don't want to go to Nebraska.
Yeah.
Now I want to go to Florida. Wherever you match is a contract, you must go. And lastly, I think it may be nice just to mention the changing laws in many states. I've been following Tennessee and I've been following Iowa, have a huge shortage of doctors. And because of that, they're sort of relaxing some of their IMG restrictions. Maybe you can just mention the one about if you are ECFMG certified, maybe you don't have to do residency. You can come and work in some of the hospitals there, maybe, if you know a little bit more.
Just a little bit, like in Tennessee, this law which was just passed, I think last year, started. It's July 24th last year. If you're IMG and you've done residency out of yours, like you're special, say you're a pediatrician or you're hospital somewhere outside yours, you can practice in Tennessee without going through residency again. But the only requirement you have is that you need to be ECFMG certified. That means you must have gone through step 1, step 2, step 3, and got the ECFMG certificate. And you need at least 2 years of experience outside US for you to be able to practice in Tennessee. So, like, let's say you're a pediatrician somewhere in Kenyatta University Hospital or Muhimbili, then you've got 5 years of experience working in Muhimbili. After you do your step 1, step 2, you get your ECFMG certified, you can apply for a job here in Tennessee. The hospital don't have really much information what's after that, but those are just basic requirements that I know of now. But I can find out more information about it and I can try to share with James Coder so that he can send to you all. But that's pretty much it. I think Tennessee is one of the states which is doing that, and some other states that have not much about it, but that's it.
Yeah, awesome. Awesome.
Yeah.
Thank you so much.
So,
Yeah, I found a link that at least can get people started on that trend. And I think this may be surprising to people given all the anti-immigrant rhetoric that's going on at the national levels. But at the state levels, they're very practical because there are many parts of the United States that have a huge shortage of specialized physicians.
Yeah,
All
so
right, awesome.
we have one of our panelists, Roland Semakula, is from Uganda, is in Texas. He joined us late. Roland, unmute and say hello if you have any few words to add. You know, I need to use your skills. Welcome, Roland.
Oh, hi. Yeah, sorry about joining late. You guys have done a brilliant job. I think you've touched on everything. I don't think there's anything else I could add. I think for me, the biggest advice for matching that I tell people is it's about networking. To me, that's my most important thing. Even more than your scores. I did not have the highest scores. I had red flags in med school, but it's about the networking. Because when you network, they're going to write you solid letters of recommendation. One of the panelists talked about how important that is, and it sells you. And by networking, it's essentially those mentors that you get are going to help you with preparation for interviews, as someone said. Doing mock interviews changed everything because the Americans talk in a certain way. You have to be confident, and a lot of us are not raised like that. And also they're usually very precise and succinct. So I think that's the most important thing. So for people who you guys talked about all the different ways you can network. I never did an elective in the US at all. All I did was I had 3 letters of recommendation. I had 4 letters of recommendation, but I had 3 from US-based physicians, and that was able to get me interviews. I got 4 interviews, even at a very nice, prestigious program. I didn't rank it fast because it wasn't giving me the type of visa I wanted. And that also is very important. I know when you're joining initially, we may not think about it, but once you're here, it becomes something very important over the long term. If you can get like an H1B, the J1, and as people have mentioned, with all this sort of anti-immigrant sort of bias, these type of things become more important. But I really cannot overemphasize networking. And what I mean by that is that, so if you're working on a project with someone, just kind of stay in touch, as someone mentioned. Stay in touch with them, let them be your friends. For me, my mentors were working on a project virtually, and that's how I got to know them. But I go and visit one of them in Houston every time I'm in Houston because I'm in Corpus Christi at Risco Children's Hospital. And I stay at her place when I'm in Houston. They help you to that extent, and they're also going to help me as I prepare for my applications, probably for fellowship programs. So it's probably the most important thing because, as someone said, the scores, you learn these things. All of you are very brilliant by the time you're able to sit these exams. But your mentors help, like your guiding light. They help teach you, and they really need to know that the American physicians only vouch for you if they trust you because it's their reputation on the line. So if they're able to vouch for you, programs are going to want to take you. So I think that's all I could say about it. Thank you.
Thank you very much, Roland. I mean, that's money on. I mean, so God bless you. Say you got 5 letters. Some of the physician you just met them in Tanzania? I'm sure you didn't visit 5 facilities in the US.
Yeah.
Is that the case? And yeah.
So yeah, before answering that question, I should like echo a little bit what Roland said. So personal statement and the way you talk yourself during the interview, it's a totally different as compared to African setting. So East African, we are like a little bit more polite. You don't boast about yourself. You don't boast about your successes because if you do that, no one gives you the job. But in US, your personal statement during the interview, you need someone from US to coach you how to put your abilities through answering the question so that you shine. Like, you know, your problem solving, your abilities, you need to put them in your answering question. And also your personal statement has to be a little bit American way, has to be a little bit boastful, which is not the culture we grew up with. So it's a very good idea to have someone who like from a US system to help you, you know, navigate all of that so that you know, you have the better chances at the end of the day. So for my letter of recommendation, so my working place has a very strong relations with US place, and particularly the place that I actually match into. My boss trained there, so that also helps, and that is also the place that I did externship at. But we also do like a year conference where we invite pediatrician neonatologists to we carry out 6 days of neonatology conference, which I also am one of the organizers. So like you meet with these neonatologists, the pediatricians, you talk about them. Initially, you don't tell them your dream. We just like work. But at the end of the day, they'll ask you, you know, what are your plans? Where are you in your training and everything? And they, you know, they will offer to support you at the end of the day. And, you know, you work with them and everything. And that's how, you know, after most of the people that I wrote my letters of recommendation, we had worked with them for like 3 years. It's maybe only one person who I worked with them like through the extension part. So actually, one of them actually trained me when I was like enrolling at my medical officer position in the neonatal ICU. So there was already like a strong 2-3 years of like working experience. So probably at the place you are, either the medical school, either you know your working area, you have like some connections. Either it's the medical students, the faculty who come and visit and everything. When you work with them, and then you know they'll tell you like, how can I help you facilitate your dreams and everything. They can help with the connection. Sometimes they can write you a letter of recommendation. So you know that actually helped me a lot. That's why maybe I was a little bit, you know, confident of not exhausting all the funds, applying to like 200 places or like 100 places as like a normal IMG would have.
Thank you. God bless. Yeah. So, I mean, guys, really, as you can see, we have more panelists, almost panelists equaling the number of applicants. This is really a prime time. It's time like it's very crucial. It's very important. We take it with a lot of weight. And I look forward to have you guys come to the forum on this side and help people starting from November, even before you march. Volunteer, help people, you know, work on, and let's move things. And this conversation continues, you know. And I said, my promise, you are ECFMG certified. I give you my personal cell phone number. You're my colleague, you know, we work through, and I expect you when I call you, you're gonna pick up. Because now you're calling me, I'm picking up. That's the rule. Okay, Frank, I think we should
No,
wrap up.
that's awesome. I think this was a phenomenal session. I really appreciate everybody sharing their insights. Again, we shared a lot of information here. Sometimes you may have to look at it more than once. And also we are going to share the AI summary. So that's another way people may have an easier time processing the key points via the Zoom AI summary. So that will be shared with everybody. But, you know, every now and then, you know, this journey can be hard. And so you may need a word of inspiration and whatnot. Hopefully you can just tune into some of these videos, have them play in the background to kind of remind you some of this stuff is possible. Because I think it's like we have almost 10, half of this call are people on this side, which is kind of quite amazing actually, right? So you have almost, we could do one-to-one mentorship just based on this call, which is a really good number in terms of you having like really good insight. I was kind of surprised when one of the applicants said they didn't know what Signal was and they're going through the process. So we want to make sure you don't find those kind of surprises, or you don't know about like setting up your Zoom or making sure your internet works. Just trying to make sure you don't make like silly mistakes that can be really costly. You know, there's nothing like being on a Zoom interview and your network cuts out or your electricity cuts out. I mean, you can't have that kind of stuff because you can't really like easily reschedule those things, and you just kind of end up like looking sloppy for things that are sort of in your control. For the most part, I think we really want to make sure that you guys are really well versed. So I think this concludes the sessions, I guess, for this 2025 year. I guess until the next season, where we'll go back to the one-on-one for the next cohort. But again, all of you should be in the USMLE Pursuit at Gmail. That is the best way for us to communicate moving forward. Please appreciate that it's very difficult for us to communicate one-on-one with each and every applicant. So in general, we like to communicate in cohorts because chances are whatever one question you have, many other of your colleagues have the same question. So I don't want to answer the same question 10, 15 times, which is what we did before when we were doing these videos. So if you go to like one-on-one, we kind of explain how we kind of came to this system that many people will know either me personally or Dr. Ignas personally, and each one of them requesting a 2-3 hour session to kind of go over this information one-on-one. And it became kind of a little bit ridiculous. So I think now that we have this information, it's distilled nicely. You have 101, 201, 301 as appropriate wherever you are in the stage of your journey. We're here to help you. And again, thank you so much. In respect for time, we really like to close on time. Sorry that we started a little bit late, but I think this was a good 2 hours of your weekend, and I hope that you guys will tune in again and share this information. Definitely, as I mentioned, also like please tune into that case on the Ministry of Health and see if you could have done better for that patient, and you'll realize that many patients who we can do a lot better if we have like proper training. And that may be the next version of these talks, that maybe at some point I dream that maybe we'll have just a case conference and people present cases and we actually mark how people can do morning report, where you just present the case and we see like you see how a morning report is run. So actually I would love to go to that session that's preparing IMGs, like go morning report, how you're supposed to present patients, what's expected, what's the level of performance. And so you guys can have some insight into how things work in this system, which I feel is fairly efficient, especially for very sick patients. We don't do a good job on preventive medicine, which Dr. Ignas is trying to fix. And primary care, we don't do such a good job. But if you're really sick, I think the United States does a phenomenal job for those patients who are extremely sick and really challenging cases, at least at academic centers. I can vouch for that. So again, without further ado, we will adjourn. This should happen on YouTube over later this afternoon. And again, Dr. Ignas, thank you so much for putting the slides together, the presentation, and all of our panelists. Thank you so much for joining in. And without further ado, I return your Saturday back to you guys. Thank you so much.
Thank you. Thank you, everybody.
Thank you, guys.